Good evening, everyone, and welcome to tonight's CPD webinar, Rest Assured, Digital Therapeutics for Insomnia and Mental Health. My name is Kat McPherson. I'm the Mental Health Team Leader at Central and Eastern Sydney PHN. Tonight, I'm joined by Christina in the CPD team, and our speakers for this evening, Katie Dobson, Clinical Psychologist from This Way Up and the Clinical Research Unit for Anxiety and Depression, and Marie-Louise Singh, the Clinical Implementation Lead from This Way Up. I would like to start by acknowledging the traditional custodians and sovereign people of the lands across which we work. I recognise their continuing connection to land, water and community, and pay respect to elders past, present and emerging. I'd also like to extend that respect to any Aboriginal colleagues who are joining us tonight. I'd like to acknowledge the people with lived experience of mental health and recognise their vital contribution and value their courage to share this unique perspective. For housekeeping, please note that this webinar will be recorded and will be available on the CESPN YouTube channel within the next couple of days. Please submit any questions you may have into the Q&A function at the bottom of your screen, and we will address all questions at the end of the presentation. At the end of the webinar, an evaluation survey will pop up on your screens, and a post-training survey will also be emailed to you. So I would like to introduce you to our speakers. Katie Dobson is a clinical psychologist based at the Clinical Research Unit for Anxiety and Depression and This Way Up at St Vincent's Public Hospital, Sydney. In her role here, she provides cognitive behaviour therapy to adults presenting with a range of anxiety disorders and co-occurring depressive symptoms, in addition to supporting consumers and clinicians integrating digital mental health into their practice using the evidence-based online treatment programs developed by This Way Up. Katie has a strong research and clinical interest in the treatment of anxiety disorders across the lifespan. And with her is Marie-Louise Singh, who is Clinical Implementation Lead for This Way Up. Marie is a social worker with additional training in philosophy, arts, and positive behaviour support. Her practice has spanned direct delivery and leadership in mental health, disability, homelessness, and community service development. Marie drives sustainable service innovation through assessment and optimization of care with and for consumers, their families, and frontline workers, and she provides implementation support for using This Way Up in routine care. And insomnia is something that affects around 1 in 3 adults and has a huge impact on people's physical and mental health. So we're very grateful to have Katie and Marie here today to share their expertise. Thank you.
Thanks very much, Kat. I might just take a moment briefly to get my slides showing. Can you see the slides there?
Yes, we can see the slides.
Excellent, thank you. Just double checking. Thanks for the lovely introductions, Kat. I'm Katie Dobson. I'm one of the clinical psychologists here at This Way Up and the Clinical Research Unit for Anxiety and Depression. Though that's quite a mouthful, so we just call it or refer to it as CRUfAD. And I'll be speaking tonight with my colleague Marie about This Way Up digital therapeutics for insomnia and mental health. And we anticipate the talk might take roughly 40 minutes, but there'll be plenty of time for questions and comments and things along the way. So if you do have questions, we'll do our best to get to those at some point, if not at the end of the presentation tonight. I don't know if you want to say a few words as well, Marie, before we go into it.
Thank you, Kat, for the introduction. We're really happy to be here talking to you all about insomnia and mental health. I'll be on the chat tonight, so if anyone would like to enter a question or a comment, we will get to those as we move through.
Excellent. Thanks, Marie. Okay. Marie and I would also like to acknowledge that we are presenting tonight from Gadigal land of the Eora Nation, and to acknowledge traditional owners of the lands on which we are presenting to you from tonight, and where I imagine that everyone is joining in, listening to remotely tonight, working within the CES PHN. We acknowledge that they have occupied and cared for these lands over countless generations, and we celebrate their continuing contribution to the life of this region. And I guess also just to flag that it is the beginning of NAIDOC week today. So it's, yeah, a particularly important time to reflect these kind of, these learnings. So just before getting into more of the specifics of tonight's webinar, we do like to start presentations where we're talking about digital therapeutics and digital mental health from the perspective of people who've utilised them and benefited from them, to hear from their own experience. So one consumer has shared with our team their experience, which I'll share on their behalf. Growing up neurodivergent, I had to fight and learn harder than anyone else. I had to teach myself social skills, culture, and communications myself because my caregivers neglected me. I grew up broken and self-destructive. This Way Up gave me the resources and community to realise that for once in life, I'm not a disease to be cured, a problem to be prayed away. It was the first time I felt accepted as a normal human being. And another recovery story, I guess, again, just to highlight the reach and the scope of individuals in facing very different and unique life circumstances that have used and benefited from digital online treatments at This Way Up. So this was from a consumer that was based in a regional Victoria location back in kind of COVID lockdown times. And in her words, I've just completed the This Way Up program. I started it in January as a result of a personal crisis. My husband left me after many years with no notice, and it would take 7 weeks before I could speak with a psychologist. This Way Up helped me through a very dark time in my life. The benefits of the modules were immediately felt. I worked on every exercise in the program. When there was no one to help me except the grief line, this program was my go-to resource for getting through one day at a time. It's structured to provide assistance to people like me who were doing it tough, coping with anxiety and worry in their own at home. So just a brief snapshot of where Marie and I physically are located tonight, presenting the webinar. We're at the Clinical Research Unit for Anxiety and Depression, which is a service that's based at St Vincent's Public Hospital, Sydney in Darlinghurst. And within CRUfAD, there are 3 individual kind of teams. We all work together, but yeah, there's sort of 3 components to our broader team. One of those is the Anxiety Disorders Clinic. So this is a clinic based here at St Vincent's where we see adult patients presenting with a primary issue of an anxiety disorder, but there's often some co-occurring comorbidities such as depression and insomnia, most commonly, I would say. So we see adults usually for face-to-face treatment, but also via telehealth platforms. And within the Anxiety Disorders Clinic, we use a blended model of care. So we integrate digital mental health treatment as an adjunctive or blending with our face-to-face treatment model. We then have our research team, known as the Virtual Clinic, that run numerous randomized controlled trials within the service. And then we also have This Way Up, which is our online digital mental health provider. So you can sort of see how these different teams really collaborate and work together, but we do have those 3 branches, and I like to just give a snapshot because it can be a little bit confusing to get your head around it initially. So more to tonight's presentation, what we're hoping that you can take away from this webinar are the following learning objectives. So first, we're going to speak through an introduction to iCBT, which stands for Internet or Online CBT, with This Way Up programs. We're then going to talk through some of the benefits of use of internet-delivered CBT for the treatment of insomnia. We'll speak through options to safely enhance treatment of insomnia and anxiety disorders in your own routine practice, as well as some info on how you might be able to identify appropriate or suitable clients for a digital intervention. I'll speak through a few clinical tips for suggesting and supporting the use of iCBT with your clients. Then we will speak through prescription, oversight, and responding to increased distress during an online treatment. And finally, we'd like to share with you some resources, some CPD opportunities, and further learning that you can access freely through the This Way Up platform. And we'll also get to questions. I didn't pop that on there, but we'll have time for that at the end. So firstly, just to kind of frame our thinking tonight, what are digital mental health services? So what Marie and I are really focusing on today is speaking about delivering evidence-based cognitive behaviour therapy via the internet. So different to telehealth. So we're not talking about, I guess, this kind of a didactic approach where there's a clinician on one end and the modality is a computer or a phone, but it's a live conversation between a clinician and a consumer. What we're talking about is a self-guided option. So this can be accessed through someone's phone, tablet, laptop, desktop computer. Essentially, if they have access to the internet, they're able to access this digital intervention. And it's heavily based in evidence and research. It's been developed through the CRUfAD clinic. And it's a wonderful option for a range of reasons that we'll speak through tonight. But some of those core draws to iCBT are on this slide. So we know it's effective. We know what a client is going to receive rather than be challenged by I guess, you know, something that I certainly experience from time to time, a bit of therapist drift and maybe not providing all of the core components of treatment. We know that an individual will receive the whole treatment dose. It's low to no cost, it's accessible, and it's very scalable. So it can be reached irrespective of where someone is, so long as they have access to the internet. And what are we talking about more specifically when we think about internet-delivered CBT programs? So I imagine most people in the audience tonight are going to be pretty familiar, so I won't speak too much about CBT, but it really is a strong evidence-based psychological treatment that I guess is underpinned by conceptually the bi-directional impact of what we think impacts our physical sensations and emotions, which impacts our behaviours. And this is really working in that bi-directional relationship. If we're doing things differently, it's going to affect our thoughts and feelings. If we're reframing our thoughts, it's then going to affect our emotions and what we're then choosing to do. So on this slide, we've highlighted just some of those core treatment components that a person who would be completing a This Way Up course is going to receive. So each of the programs includes psychoeducation, de-arousal or relaxation skills, core cognitive therapy skills like thought challenging, behaviour therapy skills, predominantly exposure-based skills. The programs also teach problem solving, effective communication, and each treatment includes a component on relapse prevention. Each of these treatment programs is delivered through a set of smaller modules, so you can think of those as your individual therapy sessions, and the program being that broader episode of care. They're taught via online modules and include as well homework tasks, action plans, things that the individual can then do between each module, or as we would in, I guess, more traditional therapy modalities, give someone some tasks to complete between now and the next session. So it really tries to mirror and model that same pathway and process of face-to-face therapy, but it's delivered through the online platform. So on this slide, we just have an example of what our website looks like. So if you were to jump online to the This Way Up website, this is our landing page. As a clinician, you can have a look at this. As a client or consumer, your clients can have a look at this. There's a range of freely available coping tools. This is where you can sign up, and this is kind of where everything that you might need is based. So again, just sticking at that broader level, getting an understanding as to what's available through the digital platform of This Way Up. We have 18 different treatment programs, and these are, I guess, categorized into 3 broad categories. First up, we've got our wellbeing programs. So this is stress management, insomnia, mindfulness, and student wellbeing. These are slightly shorter in length than our disorder-specific treatment programs. So I think these each have 4 online modules as opposed to 6 or 8, depending on the disorder. And these are freely available to anyone at any time. We also have below those our trans diagnostic programs. So this includes a mixed depression and anxiety program, a mindfulness enhanced CBT program, some perinatal and postnatal anxiety programs, as well as our teen worry and sadness program. And I would say that our most commonly used treatment program is that mixed depression and anxiety, as again, I'm sure everyone that is listening in tonight would be well aware. It's sort of the rule rather than the exception that a client's going to be experiencing symptoms of both low mood and anxiety if they're in your consulting room or if you're chatting with them. Then on the right, we have our disorder specific programs. So these are a little bit more tailored to specific mental health conditions. As you can see, the vast majority of those are anxiety disorders. We also have a post-traumatic stress treatment program and a chronic pain treatment program. All of these are CBT interventions, and there are two different pathways or options through which an individual can complete This Way Up program. I'll talk a little bit more to this later on, and if there's questions, I'm more than happy to answer as well. But essentially, if a person wants to complete one, they can do so at any time via the self-help pathway, where you don't need a clinician. You can just jump onto the website and sign up to a program, or they can be completed via the clinician supervised pathway. So this is where, as a clinician, you can register an account and prescribe these online CBT programs to your clients. I will just flag that 2 of our programs require clinical supervision, and that's for clinical reasons and for oversight and safety and appropriate support of that patient. And those include the post-traumatic stress program and the chronic pain program. So those are the only 2 that must have a clinician supervising an individual through their online treatment. Okay, here we can see an example of what a This Way Up program looks like. So each of the individual programs, we follow through 1 or 2 or sometimes 3 different characters and get to know them. So this is an individual who is experiencing that condition or those symptoms that the person completing the program is also going through. So we follow this sort of comic narrative structure. As our characters here, I think we have Rob and Liz, as they learn to kind of, I guess, initially recognize something doesn't feel quite right within themselves. They may have family or friends or health professionals also help them to identify something isn't quite right, and they are looking for some help and some treatment. And then they go through the CBT therapy essentially. So as the individual completing the program, I'm following through this character's recovery narrative, and hopefully along the way I'm resonating with parts of that, and I'm also learning the CBT skills with them. Okay, so here we just want to kind of speak to some interesting research that our team did earlier this year. We took a bit of a snapshot of our current user base a couple of months ago through a survey. It was a snapshot sample of people enrolled in This Way Up programs. And at that point in time, our data found that we had 250,000 Australians currently enrolled in a program. You can see on the blue map to the right whereabouts those registrations are. And it also gave us some really interesting data looking at diversity and the different life circumstances and health conditions, and I guess just the diversity within that user group. So more than our national prevalence, I think we found a roughly 72 to 73% of users within that survey reported having chronic conditions. So this is a lot higher than that national prevalence. And similarly, roughly a quarter, roughly 25% of those survey participants reported living with a disability, which again was notably higher than the national prevalence. And in the words of one of those consumers, they shared with us part of their reason for choosing This Way Up. I'm time poor, I'm often fatigued and have lots of medical bills. Being able to access something quickly in short bursts and for free is really important. So I guess we just want to speak to, understandably, sometimes it feels as though an online intervention isn't suitable when people are living with complexity. And certainly it's not suitable for everyone, but this was really nice, interesting feedback for our team that people living with disability, people living with chronic conditions and other life stresses isn't a contraindication to benefiting from the digital therapeutics. And I guess more to this point of diversity, another interesting piece of data that we like to share is the diversity in the range of prescribing health professionals that are using This Way Up, which is a really nice aspect of the platform as well. So you don't need to be a CBT trained clinician by any means to prescribe these treatment programs. You don't need to be a psychologist to prescribe the programs. Certainly you can, but it doesn't. There are many other wonderful skill sets and learnings that clinicians from a range of professions and backgrounds can bring to supporting their clients through these programs. The beauty of it is that the program will provide a lot of those core basic skills itself, and you can be there to provide other support and other expertise and sort of those other multidisciplinary aspects of care. I guess this little coloured ring chart that we have speaks to those different health professionals rather that are using This Way Up with their clients. So we have a large number of GPs prescribing the programs. We do have a large number of psychologists and allied health workers, nurse practitioners, social workers, and many more. Okay, here we have a quick snapshot of the clinical practice guidelines for anxiety disorders as well as for mood disorders. And I'd encourage you to have a look through these in your own time for a little bit more info if it's of interest to you. But I found this very interesting years ago when I started working in this field to see that the evidence for an online CBT intervention is equally as effective as face-to-face CBT. And also really heartening to see that these digital interventions are found to be recommended and as kind of frontline treatment within the practice guidelines. So they're not just resources or just tools, they're actually full evidence-based treatment interventions that we can trust, that we know have lots of research behind them and are supported in the clinical practice guidelines. Okay, so we also just wanted to share, I guess, appreciating that people are working in different spaces and coming from different training backgrounds, that there is a lot of diversity and flexibility to the spaces and how different centres have chosen to integrate This Way Up programs, and that it can really be used to enhance care in Medicare-based mental health centres. So I think this was one of the collaborations that we have done a while back. Feedback that we received from this service, our collaboration with This Way Up helps us make better use of our limited clinical resources and complements other forms of care. Our clients enjoy the immediate access and flexibility. Our clinicians like the structured format of the programs and seeing their patients get better. Okay. One moment, I just need a little sip of water. Okay. So the next part of the webinar, we're just going to speak a little bit more closely about insomnia, digital treatments for insomnia, and some really interesting research that was completed by our team, led by one of the senior clinical psychologists and research clinicians, Elizabeth Mason, about a year or so back. So this was a really interesting randomized controlled trial that was looking at the effectiveness of treating insomnia as well as treating generalized anxiety disorder, which are two very common, very prevalent mental health presentations. And also they're also very commonly co-occurring. So we know that research indicates the treatment for insomnia can be a powerful way to really reduce broadly the burden of disease associated not only with that condition itself, but with symptoms and also with anxiety and depression. This particular randomized controlled trial was looking at the This Way Up treatment for insomnia, comparing that with the internet-based CBT treatment for generalized anxiety. So individuals who were presenting with both of these conditions were randomly allocated to either the anxiety-based online treatment or the insomnia-based online treatment to get a comparison of the effectiveness. And the results found that the insomnia-based treatment was actually more effective in reducing symptoms of insomnia itself, and equally effective in reducing symptoms of anxiety. So those reductions in anxiety symptoms were happening faster for the patients in that insomnia treatment condition, which was really, really interesting to see. And I guess the results of this study have suggested that perhaps it is good to consider treating the insomnia first, because you, I guess, may get more bang for your buck, so to speak. You're going to be potentially targeting symptoms of both of those presenting issues by really focusing on getting that individual client's sleep in a better position. Which does make sense, but it's really interesting and helpful to have this backed up by research and to think about how we can reduce suffering and reduce that symptom severity in the most effective, efficient way. So on this slide, you can see Leo, who is our character in the insomnia treatment program, speaking to his experience of exhaustion and the impact of his sleep difficulties upon his day-to-day life. And I guess what Leo is highlighting is what we know from the research and working clinically with lots of individuals, that insomnia is associated with impaired physical and mental functioning, increased absences from work, high use of healthcare services, and really we know that the impact on an individual's life is significant. I think Marie and I were reflecting earlier today on the impact of even just when you have one bad night's sleep, it really does knock you. And of course, we can think of the cumulative effects to the individual, to the individuals that they have relationships with, their functioning, and it kind of just really snowballs quite quickly. So we know that insomnia is prevalent, we know it is disabling, and often again has high rates of comorbidity with commonly occurring presentations like anxiety and depression. So I guess all this to say is that we want to highlight that interesting RCT finding and propose that addressing those insomnia symptoms through an online treatment can be a really effective quick way to support a client with a range of those different symptom clusters.
One other thing to think about might be, so to implication, I guess, of that study for practitioners might be thinking about some of the stigma or hesitation or shame that some of your clients may report when discussing anxiety or depression or other diagnoses, whereas insomnia is something that people may be more readily able to ask for help with, and could be a moment to sort of capture service for other treatment that they do need. And certainly we saw with the Medicare Mental Health Centre that Katie raised before, that people completing the insomnia program were actually then flagged for further treatment for other co-occurring conditions, or through perhaps momentum and relationship then with therapists, that continuity of care, you know, raised new issues for intervention. So it's also good to think from a treatment planning perspective, you know, what would be the benefit then of using this program, knowing that the research indicates it's going to be, you know, potentially effective for their co-occurring anxiety, and there may be a strategic benefit to starting there in addition to the outcomes we saw in the RCT.
Yeah, thanks, Marie. That's very true. It kind of is, it's a softer, landing point to get started on a lot of those other aspects that might be bubbling up for someone. So just to dive a little bit deeper into the specific skills that are covered in the Insomnia program, I think I mentioned earlier, one of the other nice aspects of this one is it's a pretty short and sweet treatment. So there's 4 online modules. In terms of the pacing or the timing of doing a This Way Up program, we generally recommend that clients would complete a lesson with about a week or so between each lesson to give themselves enough time to actually put those evidence-based skills into practice and build up a routine in their day-to-day life where they're getting used to the first set of skills. For example, they're regularly completing their sleep diary, they're starting to build a wind down routine, and they're building more awareness as to the types of thoughts that start bothering them around bedtime, for example. So we don't want to overwhelm people with content. We don't want to throw too much information at them. We want this to be kind of bite-sized, approachable levels of intervention at each phase as they're moving through each of the 4 modules. So the first module will cover what is insomnia, building an understanding of one's own sleep difficulties. It also talks about the science of sleep, takes individuals through, you know, the reasons why sleep hygiene is so important without just saying it's important, you should do it. It really gives us a solid understanding that that person can then understand, okay, yeah, that does happen for me. I can notice that, I recognize that symptom in myself. The second lesson takes the consumer through managing sleep interfering thoughts and behaviours, where they're learning strategies for reducing arousal in bed and retaining your brain to associate bed with sleep rather than bed with worry, or bed with doom scrolling on social media, or bed with the time where I feel terrible because I'm alone with my thoughts. So trying to, I guess, condition a more positive or neutral relationship that fosters time to go to sleep with bed. Lesson number 3 focuses again on some more skills around managing interfering thoughts and behaviours that disrupt sleep, such as improving sleep quality. I think one of the main components of this one is looking at stimulus control therapy, which really is about how can I control that environment to be something that pairs bed with sleep rather than these other behaviours that may have unconsciously crept in for me that are maintaining my insomnia. And lesson 4 looks at reviewing all of the skills that the client has learned. How can I maintain these behaviour changes that I've started working on? Learning to balance daytime stimulation with good sleep, as well as general self-care and relapse prevention, as well as a really core component to that final module or lesson. Okay, so that sort of takes us through the nitty-gritty of the Insomnia program. Now we want to zoom out a little bit broadly and think of the different ways which you could consider certainly using the Insomnia program or any of the other programs if they feel more suited to your clients that you're working with, how you could consider integrating those into practice. So how This Way Up programs in the work, I guess, that we do here at the clinic, but also that many other hospital teams, other services integrate this into their practice. One example being, I also work 1 day a week in a private practice, so I use it there in a slightly different model than I would here in the anxiety clinic, but I find it's quite helpful there too. So one such way is waitlist management. So we partnered with a few services that have found this to be really effective. One that comes to mind is a Headspace service that uses the This Way Up modules as waitlist management so that clients are receiving some form of intervention while they wait, which can get them ready to engage with treatment, and it also helps to prevent symptoms worsening while they're in that kind of waiting period. Similarly, it can help to prepare somebody for face-to-face treatment. I think Marie touched really nicely on this earlier. If someone might be experiencing feelings of shame or their stigma is impacting their readiness to engage in face-to-face, a digital intervention can be a really nice way to provide evidence-based care, provide some psychoeducation, and maybe familiarize that person with feeling a bit more ready, or feeling like they might actually want to go and talk to someone if that's needed for them. The iCBT programs can also be used and are often used as a standalone intervention. So we know that they're effective for treating mild to moderate anxiety and depression. They can be particularly useful when access to services is limited, which is often the case, and is particularly the case in more rural and remote locations. Blended care is another excellent model that can be used to integrate iCBT alongside face-to-face or telehealth sessions. So this is where we're kind of blending the digital treatment programs with our standard care. We often use this in the anxiety clinic, where I might be, or I would use it this way in private practice. We'll talk a little bit more to that later. Blended care, very similar to, but not to be confused with, as I've kind of just done with adjunctive intervention. Marie will be able to help me out here a little bit, I'm sure. But when we think of an adjunctive intervention, we're thinking about iCBT being provided whilst you provide another treatment for something comorbid. So when I'm speaking to blended care in the anxiety clinic, for example, I might be working with a client who's suffering from panic attacks. So they might be getting blended care for those panic attack symptoms through the panic digital program, as well as our sessions where we're doing some pretty tailored or targeted exposure-based therapy interventions. That adjunctive intervention might be used more where an individual has a range of presenting issues, for example, some personality vulnerabilities, where they might be engaged in dialectical behaviour therapy in one service or under your care, for example, but they're also suffering from insomnia, and so they're getting that adjunctive insomnia treatment alongside another intervention. And finally, we also often see This Way Up programs being used as relapse prevention. So it might be that towards the end of working with someone, you get them started with a digital intervention as a way to kind of review and really consolidate the work that you've done together. Or it might be that at the point of discharge, when they've finished their current episode of care, you let them know about a program that you think might be helpful to keep them engaged with practicing those skills. So we see it used in both of those ways to provide some additional evidence-based support at the end of someone's journey with an individual clinician or with a service. Okay. So this slide speaks a little bit to who is suitable for a This Way Up program. And I guess what we'd say is, like any intervention, we have to be thinking about a person's individual case formulation and where and if a digital program might fit. But these are some of the core things to keep in mind. So clients may be suitable for one of the This Way Up programs if they have mild, moderate to severe anxiety or depressive disorder. And I apologise, I think previously I said mild to moderate, but we do actually have evidence that the programs are effective in treating that range of severity of anxiety, depressive disorders. This Way Up programs may be suitable for those who are looking for really convenient and accessible treatment, where perhaps there might be other barriers to accessing treatment. They're interested to learn skills and strategies to help them manage their concerns, and they're able to undertake an online program, which may or may not be in conjunction with other prescribed treatments. So I guess that really means that they have access to the internet and a device that they can use it on, which may be at a public library, for example. This Way Up programs are generally not suitable as standalone interventions for the following. So not suitable to be recommended and not provided any further follow-up care or any ongoing supervision and support for individuals who are currently suicidal or at risk of harming themselves or others. Those who have acute symptoms of bipolar, psychosis, or schizophrenia. those who are regularly taking benzodiazepines and or atypical antipsychotics, those with acute substance use disorders, and those in severe distress or currently managing acutely stressful life circumstances. So for individuals who may meet these more recent criteria I've just spoken through, these individuals understandably are going to require a thorough assessment to determine if and how a self-paced online program can add value to their treatment. So it's not that it's ruled out as something that wouldn't be helpful, but there's going to need to be a bit more thought as to the when and the how, and how might a team or an individual be able to support that person if it is suitable for them to be having a go at an online program. Okay. As I mentioned before, of course, like any treatment, digital CBT, online CBT isn't for everyone. There are a percentage of individuals whose unfortunately symptoms don't respond well to this treatment. And I guess, again, like any individual, we have to then reassess and think about why that might be the case. So common reflective questions that we often might ask ourselves are, was CBT perhaps not the right treatment for that person at that particular time for that particular presenting issue? Other considerations can include, well, were there difficulties engaging with the online program and then applying what they were learning to day-to-day life? How might that issue be supported or addressed, perhaps with additional clinical support? The level of complexity and severity, of course, of the mental health issues may have impacted things. And other considerations might include perhaps the individual was needing a little bit of extra support. Would, say, a blended care approach or some check-in phone contact with a clinician that's more a supervised pathway rather than self-led and self-guided, perhaps that might suit.
And just on that last point, we've just seen some really creative and clever supportive adaptations and pivots from services when they are looking at their use of these digital treatments. So there are some instances in which, as Katie's highlighted here, you know, for a variety of reasons, there may just not be that fit, that chemistry, that compatibility between client and the time in their life and the treatment. But there have also been some really interesting cases that we've seen where a small adjustment to what the content and goals of the in-person service was actually then affected the person being able to then complete that next module and the next activities. And you know, perhaps they were getting stuck because of a particular exercise that they're being recommended to apply, and actually being able to workshop that exercise in person with their therapist meant they were then comfortable to try it at home next week. So I just would kind of encourage here as well to think about if something isn't working for a client and we know that they are indicated to benefit from CBT, and we think that, you know, they've got some of the appropriate resources to do a treatment, just asking those questions and actually feeling comfortable to come up with some adaptations, or, you know, to reach out to help into our service to kind of look at how we can work with you to, you know, make the best outcome for your client, I suppose, who this may be appropriate for.
Thanks, Marie. Okay. So more to this question of, I guess, suitability, who may benefit from or for whom is internet delivered CBT a good fit? We understandably are often asked the question about older adults. So what about elderly clients who may have lower tech literacy, not be online quite as much? We did complete, there is some research that has looked into this, and it actually found some quite interesting results suggesting that the older adult age group actually had a stronger adherence with the online treatment program. So we're more diligent and, I guess, completing a higher number of those online modules. So we're not aware of evidence that older adults don't benefit from these programs. Of course, like any individual client, it needs to be the right fit for that person. In my experience, the most helpful part of getting anyone of any age started and to have, I guess, effective adherence and benefit from the programs is how I introduce it to them, like what my rationale is for recommending the program and kind of onboarding them. So showing them the website, sitting down together and going, okay, I've sent you the registration email, click on it, let's sign up together. Or would you be happy for us to sign up together? Get their consent first, of course, but really just kind of building that familiarity and having a clear treatment rationale, rather than age-related concerns. That seems to be when I have a bit more, when I make sure that that is strong, it tends to be quite an effective outcome. Another really good question that we get asked often is, what about clients with maybe more complex issues, so comorbid personality difficulties? Our team did complete a study in this area as well, looking at comorbid personality difficulties with treatment outcomes for online CBT. And the research has indicated that iCBT was still helpful for reducing symptoms of anxiety and depression among individuals with comorbid personality difficulties. So it's not a direct treatment, of course, for the personality disorder, but it certainly can and has been shown to be effective for treating comorbid anxiety disorders or comorbid depressive disorders. So this might be a nice example of how iCBT can be used adjunctively. So to reduce symptom severity or to treat Axis 1 issues when there might be other complexities that an individual is dealing with as well. Okay, so the next couple of slides, I just wanted to have a few visual examples as to some of the features that I find really helpful when I'm supervising clients through the online CBT programs. So if you do decide to create a clinician account, which is really quick and easy, you just sign up with your name and email address. This is one of the features that you'll have. So when a client is enrolled in a program and they get started and work their way through the different lessons and modules, as their supervising clinician, you're able to monitor their progress. So I can see when someone has gotten started with their program, I can see how they're progressing, and I can also follow their symptom self-report measures. So that's another great feature of the digital online programs. The client, each time that they complete a lesson, they'll always be asked to complete the K10 measure of psychological distress, and sort of at the beginning, middle and end of treatment. So that's usually lesson 1, lesson 4 and lesson 6 of a 6-lesson intervention. They'll also be asked to complete some brief self-report measures that are looking at symptoms of that specific problem that they're seeking treatment for. For example, in the generalized anxiety program, the GAD-7 or anxiety measurement tool will be implemented at those time points. So it's just a really nice way of being able to track kind of live data for that client. The client, of course, and very importantly, can see this as well. So they're able to monitor and track their own progress, have a look at their symptoms. Are things going up for me this week? Are things going down? It's a really nice tool to be able to use in sessions to reflect on what might be, if there might have been a potentially triggering situation, building up skillfulness around dealing with that next time, and a good indication as well as part of an assessment tool, kind of when someone's completed their program, where are things at now, what skills have been helpful, are there additional supports you might need, or have things improved for you significantly. This is just another visual snapshot of that clinician dashboard. So these are, the previous slide shows the visual graph. This one shows the actual questionnaire scores of this client. And you'll see that some of them are blue and some of them are red. So it's another component that's built into all of the This Way Up programs is our risk management system, which will notify, I guess, if a client is reporting high levels of distress on the K10 measure, and or high levels of depressive symptoms on the depression measure, which is the PHQ-9 scale that are used in the This Way Up programs. It will prompt an alert email message to that client. And also, if I'm supervising someone as their supervising clinician, I will receive a notification email as well, and their scores will pop up red until I review them. I can then click on that score, have a look at the questionnaire items, and I guess, yeah, use my clinical judgment, use my assessment and knowledge of that client to then determine what I might do next. So this slide, we'd like to just give a snapshot of what those risk notification and management system emails look like. So on the left is a quick snapshot of what the client would receive. And then for me as their supervising clinician, I also receive an email that notifies me, hey, your client has scored highly on this particular measure. We recommend you jump into your clinician dashboard to review. So it's just, again, it's quite a helpful tool. The client's email, of course, it provides a validating message. It sends them crisis support lines and encourages that person to reach out for support if they are feeling unsafe. And as their clinician, I find it reassuring because I'm getting information that gives it sort of, in the contact that I have with the client, we can reflect on what may have been going on at that time. If I have more acute concerns about that person's well-being, I can contact them. You can also discuss these components of the intervention rather with a client, of course, ahead of time. So I always let clients know, hey, you'll be asked to complete some measures as you go. If your scores on those measures are high, we're both going to be informed of that. And it would just be part of my usual safety plan discussion that I'd have with that individual. Yeah, I think that was all from that slide. So we did just want to highlight again some more visuals to show you what that clinician dashboard looks like. We've actually just had a recent change to some of the visuals there. So this is how I would prescribe a program to a client. I'd pop in their name, I'd pop in their email address, and I would then from this drop down select the appropriate program that I'm wanting them to do. So for example, the Insomnia program. And I would then click tick to waive the $59 program fee. So I should also mention that the treatment programs are totally free of charge to the client and the clinician. It's all completely free to the clinician if you're prescribing the treatment program. So the self-help pathway, there is a small fee to clients, which is $59 for that program fee. But a really nice additional benefit as a prescribing clinician is you can provide that intervention to your client free of charge. Okay. Alrighty, I'm just going to talk us through how I might introduce it to a client. So I think I mentioned earlier that providing a clear rationale for CBT is important, as I would with any other treatment. Why is this helpful? Will I be showing them the individual case formulation, highlighting the types of thoughts that are unhelpful, that are keeping that person stuck in, I guess, that challenging cycle? We'd be looking at some of the avoidance or safety behaviours that, again, are really understandable, and I'd normalize them and validate them. And also together we'd have a look at how those kind of behaviours are unhelpful, and then speak to this evidence-based intervention that has been designed to help reduce these unhelpful thoughts and shift these behaviours. I let people know it's short-term, it's skills-based, and I really speak to the importance of regularly practicing the skills that they're learning in the online intervention. And I then would talk about those options of self-help or clinician supervised. We did just want to share, I guess, that point that I touched on earlier. I think the most important thing is that onboarding process. So for me, if I'm seeing a patient in the anxiety clinic, it only takes about 2 to 5 minutes, this part of introducing the This Way Up program. But my belief and confidence in it is, I think, paramount, because like any intervention, if It's unclear why, you know, if we're being asked to do something that's really difficult and we don't understand why, and it requires effort, it's unlikely that we're going to follow through. Whereas if we have a solid understanding as to how is this going to help me feel better? What issues is it going to help me reduce? How do I actually get started? We can address those kind of core questions. The person is much more likely to be able to get on board, and they're going to feel supported and understood as well. So we've just got some examples here of people sharing the importance of their doctor or their health professional, you know, taking the time to introduce the program, show them how it works, and then kind of off they go. The intervention, the program kind of does that part of the intervention from that point. So I might say something along these lines. I might tailor this depending on the individual client's circumstances, but usually an example of what I might say is to a client, our sessions are going to involve learning new skills that are going to reduce how anxious you feel day to day. Practicing these skills regularly outside of our sessions is a really key part of helping you to feel better sooner. And that's why I want to recommend this great online treatment program called This Way Up. It will help to reinforce the CBT skills we cover in sessions. And then if I haven't already spoken to them about the research behind the programs and the trustworthiness I'd mentioned, the program was developed at the Clinical Research Unit for Anxiety and Depression at St. Vincent's Hospital and has lots of research behind them, so we know it really works. And then give them a bit of an intro as to the time that it might take. So the program has 6 online modules. Each of them will take you about an hour to get through. I've used this program with lots of people and find it really helps. That's just an example. Now we just want to highlight some of the resources that you may find helpful in your clinical practice. One is our online assessment. So this is called our Take a Test tool. It's self-guided. Clients can complete it online in probably about 10 minutes, and it takes them through a battery of different self-report measures, looking at the range of different symptoms for each of our treatment programs, and will then recommend a program or several programs that match with those symptoms that they're reporting to be most troubling for them. Within our clinician platform, so we call this our clinician dashboard, we have a large number of training materials. So we do have some training videos looking at core CBT skills, so how to challenge unhelpful thoughts in social anxiety disorder, how to do exposure and response prevention for OCD, just to name a couple. And we also have a range of treatment manuals, just highlighting this in case it's helpful or of interest to anyone listening in tonight. We also have our iCBT Foundations for Clinician program, which is a program rather for clinicians that might be interested in learning more about CBT and more about internet delivered CBT. And it was recently accredited as well by the Australian College of Rural and Remote Medicine for 6 hours of CPD. There's a range of psychoeducation and CBT resources that you can find on the website as well. Just thought I'd highlight some that are commonly used, as well as some really lovely multilingual resources. So we've had our coping tool resources translated into the 10 most commonly spoken languages in New South Wales other than English. Many clients and their families and loved ones find these very helpful, and they just sit on the website too. Thank you for all listening so patiently. I've been talking for a bit longer than I thought I would, so I appreciate everyone being so patient. I hope that was helpful. That concludes, I guess, the formal part of the presentation tonight. Please feel free to use the QR code. I think that all of these slides will be shared with you at the end of the webinar. You're very welcome to reach out to us. We're always happy to speak with people and answer any questions that you might have after the webinar. But yeah, we'll pass it over to any questions now. Thank you.
I can't see any questions in the chat yet. Does anyone have any questions they want to ask about either insomnia or using iCBT? Any clients you have thought about using it with, but you're not sure, or any comments that you want to make?
We also understand if, given it's a bit of a late one, if anyone's struggling with insomnia symptoms at the moment, that would be understandable, or feeling tired. I'm just being silly, but yeah, if questions come up later, I guess I do just want to stress we're always happy to receive those or help out where we can.
Well, I can't see any coming in.
No problem.
Here we go. We've got a question from someone saying, insomnia without any medication, what can you do?
Okay, yeah. Great question. And I guess just to clarify, is that around if the individual doesn't have access to medication, or how can I treat it without medication? And I suppose to that one, I would say an excellent approach, and an approach with lots of evidence behind it, is the CBT approach. So cognitive behaviour therapy for insomnia is sort of a first-line evidence-based treatment. And a free option for that would be the This Way Up insomnia program. It may also be that the client is seeking, understandably, something that's going to kind of ease those symptoms quickly. That's something that comes up a lot, is that, understandably, as human beings, we don't want to suffer. We want that suffering to go away quickly. And I guess to that, I would say it's very understandable people seeking medication, and it's not that we're anti-medication by any means, but sometimes it may not help the individual to learn longer-term strategies to actually address the underlying issues of insomnia. CBT is quite a quick, like a short-term skills-based treatment that can be helpful. So it's also my knowledge area, so I can't speak much to medication treatment options, but it is a very effective treatment.
And when you have a chance to look into the actual programs, it is really quite a robust kind of program. So not just the psychoeducation content, but the actual activities afterward involve putting together your own model of insomnia and practicing, some of those key therapies that Katie mentioned. So, brief but quite high fidelity, very effective kind of exercises. It would definitely be worth seeing if something like that's, low demand, can be done in your own home, but, really high integrity kind of treatment would be, if they would be open to it. And if not, why not?
Thanks. And the pardon me, sorry. I've got another question about how long are gains maintained post-intervention?
Okay, yeah, great question. I think I'm trying to recall from that specific RCT, I think we collected follow-up data for 3 months at follow-up, and that gains were maintained for both the insomnia symptom, that as in insomnia remained reduced, as did the anxiety symptoms at the 3-month follow-up period. But that's just for that one particular RCT. I think more broadly speaking, I can't give you the exact figure, I'm sorry, but more broadly speaking, I guess just looking at effectiveness of cognitive behaviour therapy for insomnia, there are a range of larger follow-up studies that indicate it is quite effective long-term, but I can't give the exact data right now, I'm sorry.
Thanks for that. So we've also got a few thank yous, and somebody's very keen to look at the multilingual resources, so it's really great that you've got those.
Excellent. Thanks everyone. Glad it was helpful. And yeah, I'll just, my last plug will be, I would encourage people, if you're interested either in insomnia or just in any of those resources, to register a clinician account. Just to let everyone know it's very quick and easy. It really just involves putting your email address in and your name, and then you know, you can sort of dip a toe at looking at some of those resources and maybe find some handouts that are helpful. And we'd encourage you to have a go if you're interested to prescribe some of those programs to your clients.
I'd like to just give a special thanks to our speakers, to Katie and Marie, and thank you everyone for attending. And a reminder also to please complete the online survey that will pop up in your web browser, as well as the post-training survey that will be emailed to you following the session.